You're listening to episode 97 of Present Moment. Welcome to Present Moment, Mindfulness, Practice, and Science. I'm Ted Meissner. Present Moment is a podcast with interviews, conversations, and roundtable discussions. We speak with mindfulness researchers about their newest findings published in peer-reviewed science journals, teachers about their understanding and methods as they work with students of mindfulness, authors about their books and interests, and we also speak with everyday practitioners. The website presentmomentmindfulness.com has show notes for each episode along with resource materials. Dr. Burnett-Zeigler joins us to speak about her teaching of mindfulness to socioeconomically disadvantaged women suffering from clinical depression in Chicago. You may have noticed that there is a particular challenge faced by teachers of mindfulness programs and those they teach. The problem is this: much as we may want to offer our programs for free, such open-hearted generosity may result in not being able to offer programs at all. Teachers have the same needs as everyone else in contemporary society, including food, clothing, shelter, perhaps supporting a family. These difficulties are also faced by potential participants, even more so as childcare, transportation, and other limiting factors may make it impossible to attend mindfulness programming. There are programs, however, available and helping those who may be disadvantaged in many ways in our society. One such program is helping women suffering from clinical depression in Chicago. Dr. Burnett-Zeigler treats patients at the Asher Center for the Study and Treatment of Depressive Disorders. Her clinical interests are in mood and anxiety disorders, comorbid substance use disorders, stress management, wellness, and interpersonal relationships. She has training and experience in several psychotherapy interventions, including psychodynamic psychotherapy, cognitive behavioral therapy, motivational interviewing, behavioral activation, and mindfulness meditation. Dr. Burnett-Zeigler's research focuses on examining the factors associated with mental health service utilization. She is specifically interested in attitudes and beliefs about mental health, access to mental health treatment, engagement in mental health treatment, and barriers to mental health treatment among disadvantaged populations, including racial, ethnic minorities, and those with low income, limited education, and limited access to resources. She is currently the principal investigator for the Mindfulness-Based Stress Reduction for Depressed Women in a Federally Qualified Health Center study, which examines the acceptability and preliminary efficacy of a mindfulness-based treatment for depression delivered to women in a community primary care setting. Special thanks to Carly Maletich for her introductions, making this episode possible. Our guest today is Burnett-Zeigler. Inger, welcome to the podcast.
Thank you so much for having me.
So very glad to have you here. Been looking forward to this conversation. And let's start by having you just tell us a bit about your background.
Well, I am a clinical psychologist and assistant professor at Northwestern University in the Department of Psychiatry. I've been practicing for over 10 years now and working in the space of mindfulness-based interventions for about the past 3 years. So my journey with mindfulness really starts from my beginnings as a ballet dancer. In childhood and early adulthood, I had dreams of becoming a professional dancer. And it was my ballet teacher that really introduced me to yoga. So kind of after I let go of my dreams of being a dancer, I got more interested in yoga. And during that time, I was simultaneously studying psychology as an undergraduate at Cornell University, and then as a graduate student in a clinical psychology doctoral program at Northwestern. My background in psychology as a researcher is really focused on looking at patterns of access and engagement in mental health service utilization. So really trying to understand who are the groups of people that have the highest levels of mental health need, who are also least likely to contact the mental health service system. So while I'm working on this area, I'm simultaneously becoming more and more kind of dedicated to my yoga practice. And I have the great fortune of having several yoga teachers who were not just teaching the physical practice of yoga, but were also really incorporating mindfulness principles into the physical practice. So that got me more interested in learning more about mindfulness broadly. My journey really has been a personal one. Again, this is almost 20 years since I've been out of undergrad now. Mm-hmm. And I realized as I, got more and more into yoga, more and more into mindfulness, how much I was shifting from being this anxious, neurotic graduate student to being less stressed and more present and just at ease with myself. I became curious how the things that I was learning could be of utility to the people that I was now seeing in my clinical practice now that I'm out of graduate school and working. So that was really the beginnings of the work. And like I said, for the last 3 or 4 years, I've been exploring that idea of using mindfulness and mindfulness practices and interventions to help engage people with some skills that would, improve their mood that might not otherwise access the traditional mental health service system.
Mm-hmm. Yeah, and I want us to chat about that a bit more as well, because that's one of the interesting topics is how we improve the accessibility of these programs that might help people who need it most.
Yeah, absolutely.
Very glad you brought that up. And it's interesting to hear about the doorway that you've come through with yoga and finding teachers who have a more of a contemplative practice than just the hitting the right posture, but what is it like being present in your body at that time? Are you finding that's a little different when you're in those classes as opposed to ones that are a bit more of the getting into the perfect downward dog and warrior pose? What's that like for you? Is there some sense of, this is not how I normally do it, or this is really nice?
I admittedly don't find myself in many of those classes that focus more on just the poses. Mm-hmm. I started practicing yoga before it became kind of this cultural phenomenon that it is now. And so, that kind of opened my eyes to what the practice really can do for people on a spiritual and physical level. And so I've just had some really, really great teachers, and those teachers have put me in touch with other really great teachers. And so I've kind of avoided just the physical phenomenon yoga, and I'm really grateful for the teachers that have kind of grounded me in the practice as a mindfulness practice.
Yeah, so wonderful that you found them, and so glad. And also for folks who are listening who do practice in ways that are more focused on posture and the physicality of it. There's nothing wrong with that. This is just another way of engaging with that practice.
Absolutely.
Yeah. So our main topic today that I wanted to chat with you about is the work you're doing right now in Chicago with clinically depressed women. And I'm wondering if you could say about the background of that. What prompted you to do this study, and what is it that you're doing?
Yeah, so as I mentioned, kind of my research focus for many years has been on understanding the barriers and facilitators of access and engagement in mental health services. And so there are some clear trends of people who have a need for service who are less likely to access the traditional mental health service system. And by that, I mean, go see a psychologist, psychiatrist, social worker, get your traditional cognitive behavioral therapy or get meds. And so, having personally benefited from mindfulness practices, including yoga and mindfulness meditation, I became curious, would low-income, predominantly racial ethnic minority adults be willing to learn mindfulness? And would that improve their psychological outcomes, specifically levels of stress, depression, well-being, and functioning were the outcomes that I've measured over the course of this work. Mm-hmm. So there were really a couple of questions. Like, one, if you build it, will they come?
Yeah.
And that was really important given this idea that these groups of people are not coming to care.
Right.
And then additionally, will it help? Is this something that will be of benefit in this specific population of people?
Yeah.
And so I started a partnership with a network of federally qualified health centers. And federally qualified health centers are community-based health centers that treat primarily low-income, uninsured, or underinsured individuals. The majority of the people served by the health center that I've been working with are racial ethnic minority, at least 100% below the poverty line. Many of them are formerly Medicaid or have some form of Medicaid insurance. And so I've been working with them and offering a mindfulness-based course for depressive symptoms. Mm-hmm. And this was an 8-week course. The course met for 8 weeks for 90 minutes per session, in which people were taught kind of formal and informal mindfulness skills. As a part of that work, I was not only interested in, offering this type of intervention to these women who had depressive symptoms, along with a number of other symptoms of distress that they were experiencing, but also could health staff within the center be trained to deliver the intervention. So that was a secondary focus of the work. Yeah. We're now in the 6th course, so it's demonstrated quite a bit of success. It's early data, but in terms of if you build it, will they come? They came. So that was very exciting. I'm sure a lot of researchers out there can appreciate you developed this great intervention. It has a lot of benefit, and it's difficult to get people to enroll and come in. And so the people were calling, and that was exciting to see that people in these community health centers were identifying this as something that they were interested in and something that they thought would be of benefit to them.
That's very interesting. I want to explore that maybe a bit right now, because this is part of our conversation today, is this accessibility question. And when you said, if we build it, will they come? That struck a chord, because in another podcast, I've explored this issue many times, and it's often, if you build it, they don't come. It's more than that. You really be in the community and doing outreach and meeting people where they are, rather than just opening the doors and expecting folks to come flooding in. But your experience it sounds like yours worked quite well. And I'm wondering if you had any thoughts about why that was so, how that was more effective in getting people to come in where others might be struggling a bit with that.
So I think there are a number of things. I think that, while it's exciting that people saw our brochures and they called in and they wanted to sign up, it also reflected the high level of need that was in this population and the minimal amount of services that were already available. So in in the health center that I was working in, there were few, if any, other mental health type services being offered.
Mm-hmm.
So people really needed something, and they saw themselves as feeling distressed and needing help. So I think that that was part of it. Another interesting thing is that, I'm emerged in the mindfulness world, and many of my colleagues, even if they are not mindfulness researchers, have seen the Time articles and,
Mm-hmm.
know all of the buzz. But in doing this work on the South Side of Chicago, people have very little familiarity with what a mindfulness-based intervention is, what that would consist of.
Why does this matter to me?
Why does this matter to me? And I'll share that on the brochure. I had a picture of an African-American woman in a sitting meditation posture, and they identified that as a yoga posture. And that drew a lot of people. They're like, I want to know more about yoga. I've heard of this. I haven't had an opportunity to participate in this. And so that kind of piqued people's interest as well.
That's great to hear. And since this is the 6th round, you've been doing this for a while now.
Yeah.
What are you finding in your experience with the people who have been in these programs? What's their experience been like before and after? What's that shift?
So, we do have data on 4 groups, and the data show that people demonstrate a reduction in depressive symptoms, self-reported stress, and an increase in mindfulness from baseline to 8 weeks, as well as baseline to 16 weeks, which is a 2-month follow-up period after the intervention has ended. The question always comes up, is it just the social support, or is it the actual practice of the mindfulness skills? And, although we do have some challenges in people reporting how much home practice they're actually doing, anecdotally, participants are talking about the ways in which they're bringing both formal and informal practice into their daily lives.
Mm-hmm.
So people will often talk about doing the body scan in the evening times. They'll talk about taking a mindful pause during stressful periods in their work day. So the concepts themselves seem to have really registered with the women that we've had an opportunity to work with. And then some really grasp on and make a formal practice a part of their daily lives as well.
Yeah, I'm glad you brought that up, the distinction between a very legitimate suggestion that in some kinds of studies, and this isn't limited to mindfulness, this is other areas of different human behavior studies, that it may be the social interaction part. So is there an active control? And one of the things that you're saying, and I frequently bring up and offering another perspective on that, is when people do bring up those very specific instances of, I was in this situation, I was in line, and here's the unique and specific practice that had nothing to do with the social context.
Right.
It helped me. There is some value in that as well. And it's not to diminish. Of course, there is an impact to the social context.
Absolutely.
But there is very specific and articulable circumstances of the practice itself.
Right. I couldn't agree more. And, we created a manual for the intervention, and the manual admittedly is rather lengthy. It's about 80 pages. And, I questioned, I kind of came from the philosophy that I'm going to give people the information, and if they pour into it, that's great. If they don't, that's okay as well. But I saw people had underlined, tabbed. People were really kind of engaging with the material on a cognitive level, as well as kind of practicing the skills that they were learning. So something was really registering that we were offering to them.
That's great. So you may have a few stories about what you've observed over the years in offering this program. Are there any particular that stand out to you that have made you be touched in a way that says, yeah, I'm glad I'm doing this?
Yeah. So like I said, we're in our 6th cycle now. I led the first 2 courses myself. And then we have trained some health center staff to deliver the course since then. Although I always come meet as the lead investigator, I always come meet all of the participants that enroll in each of our courses and kind of listen to the reasons why they're there. The reasons are always vast, from stress at work to stress with children to a history of diagnosed depression or anxiety or trauma. It strikes me, given that myriad of reasons why people come to the group, in addition to their limited familiarity with mindfulness, the openness with which they are there. They're there kind of with a blank slate and willing to learn and willing to take the skills back with them to kind of improve their quality of life and improve their well-being. And so that's always really powerful to me. And to hear people go through that process of not really knowing anything about mindfulness and talking about, just last week, actually, the teacher was telling me how one of the participants is doing a 5-minute meditation at her desk in the morning every day. That's so profound when people are talking about taking mindfulness pauses to improve the quality of their relationships with their partners or their children. That's so powerful. And it's the little things that collectively kind of change how people are moving through their lives that I think is really meaningful to observe. Another thing I'd like to mention is that there's 2 women that have been trained to deliver this intervention. Both of them are incredible. Both of them did not know anything about mindfulness before starting. And one thing that additionally has been really kind of touches me personally to observe is that the first part of their training is them going through a standard MBSR course. And both of them were so personally touched by going through the course and talk about how it resonated with them, kind of changed their lives personally. And then as they're starting to, teach these practices to the women that, in the health center, they're really teaching from an authentic place in which these skills have kind of changed their lives. And so, it really brings to mind kind of the opportunity to expand out these conversations, not only in work, but, how it changes each individual, how it changes how they're interacting with their own family members. One teacher was teaching people kind of what she was learning in the course with other staff in the health center, just kind of sharing it with them informally. And so that type of information sharing is really powerful. So I think there's just a lot of potential for expanding, to audiences that, don't really know much about mindfulness and mindfulness-based interventions.
Right. Yeah, I'm glad you brought up the idea of authenticity, that comes up again and again in these conversations, that is absolutely indispensable. And when people have been touched by the practice deeply in their own lives, that's the best way for them to be able to share the practice with others. And it's also interesting to see that even in delivering a program, say in the corporate world, where it's some business interests that often receive criticism of, oh, this is bad and greedy and all that what people tend to share, the participants in these programs, is how this changes their personal lives. Since much work, it's how it's deeply moving them. Have you noticed that as well, I presume, in your own work?
Absolutely. And I really think that's what comes first. You might come into it with an idea of, you're talking about the corporate space, it's going to increase productivity, it's going to increase, workplace morale, or reduce, absenteeism. And while all those outcomes may be valid, it's really, how it shapes someone on a very personal level, I believe, that comes first, and all of these other byproducts may then follow.
Yeah. So that leads me to just a question about your own practice and what you've noticed in your own life. What are some of the ways in which this has helped shape your meeting living?
Yeah. So, like I said, I really came to it via yoga. I'm still an active yogi, but I do take some time on a pretty regular basis to engage in meditation, generally brief meditations. When I started, I was a stressed out graduate student, worried about everything. Everything was a big deal. Everything was a minor catastrophe. And I can say, it wasn't. I was, all my basic needs were being met. It's just that idea of catastrophizing everyday stressors. That was kind of the space that I was in. Mm-hmm. And through the yoga practice and through the sitting practice, some of the key mindfulness skills, if you will, have just become more central. Slowing down, letting go of things that may not be as important as I would like to believe that they are. Acceptance. Acceptance of myself, acceptance of where I am in that particular moment, acceptance that things will eventually be okay, and just being, I think a lot of people that are kind of high functioning in these academic, corporate, whatever spaces, we're doers. We're all about productivity and outcome. And, if I had to think of one key difference, is that just being, slowing down and being. I still try to be productive. Northwestern wants me to be productive for sure.
Yeah.
But just appreciating that sitting is okay. Having quality time with friends is okay. That's not a waste of time. That's something that fills me up and enriches all of the other parts of my life and kind of makes me a better scholar, but also just makes me a better overall human being. So I think those would be kind of the key ways I've been personally touched.
Oh, thank you so much for sharing that, and completely agree on all counts. So for those who are interested in finding out more about Inger's work, there will be a few links on the episode page for this episode, including a TED Talk of hers. And just like to say, Inger, thank you so much for being here with us today.
Thank you for having me. I've really enjoyed our talk.
Thanks for listening. If you'd like to hear more about something you've heard in today's podcast, please come visit the website at presentmomentmindfulness.com. You'll find an entire webpage devoted to this and every episode. You can comment on the episode page and find show notes and other helpful resources for your mindfulness practice. The shakuhachi music heard on Present Moment is used by permission and through the generosity of musician Rodrigo Rodriguez. His website is linked on the Present Moment website on the About Podcast Music page. Sound editing, mixing, and mastering provided by the generosity of Anthony Dominello of StructureFromSound.com. Until next time, remember, every moment you have a choice. Make it the best you can. See you next time on Present Moment.